Weight loss drugs like Ozempic have topped headlines for over a year, branded as a miracle drug. But little is known about life after Ozempic and if people can keep off the extra pounds. According to researchers, on average, patients gain 2/3 of the weight back after getting off of the diabetes medication, kind of signaling the need to remain on the expensive meds if they want long-term success. So joining us now, gastroenterologist and obesity medicine specialist, Dr. Christopher McGowan. Dr. McGowan, thank you so much for being with us. This is certainly a concern of a lot of patients who are using these drugs. In simple terms, what happens in general when a patient stops taking the weight loss drugs?
Yeah, thanks, Nicole, and great to speak with you again. And this is such an important discussion point, and it's really the first thing that I review with any patient who's interested in starting a GLP-1 medication like Ozempic or like Wegovy, because the evidence is really quite clear. If you plan to start one of these medications, you should plan to continue it long term. And that's because these medications only work when you're taking them. They don't permanently change anything. So once you stop the medication, your body's normal weight-promoting mechanisms will fire right back up. And that means rapid onset of hunger and the inevitable return of weight.
And so you say that patients should prepare to take them long term. I think a lot of people hear that. They're so excited to lose weight. Maybe they don't really process it. And taking the medication indefinitely really isn't realistic for a lot of people because, as we said, the medication can be very expensive. What is the safest way to try to get off the drugs and kind of maybe prevent some of that weight gain?
Well, first of all, it's always important to consult with your medical provider if you plan to stop a medication. And it's not dangerous per se to stop a GLP-1 medication. They're long-acting medications. They have long half-lives in the body. They slowly exit your system when you stop them. That's all fine. But the actual risk is related to what happens next. Yeah. So if you're using Ozempic for diabetes, for instance, and you stop it, your blood sugar will go up. That poses potential health risks. If you're taking Wegovy for obesity and you stop it, your weight will increase. And that also has potential health implications. And that's why it's so important to understand that these are long-term treatments. They are not cures, and you really do need to plan to stay on them.
And Dr. McGowan, does how a patient stop, obviously speaking with their doctor, does it depend on characteristics? Let's say, is it different for men versus women, older people versus younger people, or is it pretty much the same across the board?
Well, I would first ask why someone wants to stop the medication. So if these medicines are working for you, if you can access them and afford them and tolerate them, you should plan to continue them. But I do recognize there are reasons someone may want to stop a medication or may be forced to stop a medication. And so really it's important to have that conversation with your medical team so that we can treat you as an individual and really navigate that together in the safest way possible.
And doctor, there's another issue that comes along with taking this drug. I'm talking about sagging skin. I know there were more reports of it. How often are you seeing that in your patients, and what's the best way to try to deal with it?
So there are many potential side effects of these medications, and some of these cosmetic ones have received a lot of attention. That includes things like Ozempic face, which have been discussed, as well as sagging skin. And look, nobody wants a flat, sagging Ozempic butt. But the reality is, if you lose a very significant amount of weight, you will have some loose skin. And some of these shape changes are related to loss of muscle mass. And so that's why we really focus on preserving and maintaining lean muscle when losing weight as much as possible. And that starts with proper nutrition, a significant amount of exercise along the way. And all of those things will benefit you in the long run in maintaining that weight loss.
So we hear it again, healthy diet and plenty of exercise. All right, Dr. Christopher McGowan, thank you.
Thanks so much.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.